Okay, I will straight away go and show you the video because of lack of time. So can I have the audio? Yes, yes. So it is a little different from the technique that is used in the Western world. For us,
Patient is examined on the day of injection to rule out any source of infection. Once it is okay to inject, topical anesthetic followed by 5% povidone iodine drop is instilled in the eye. Patient is then shifted to the OR after taking an informed consent. In the OR, surgeon wears a mask and scrubs for the procedure. Injection is prepared by the scrub nurse. After removing the plastic cap of the vial, the rubber cap is sterilized with alcohol. Alcohol is allowed to dry. The filter needle is introduced into the bottle. The bottle is tilted so that the drug flows towards the tip of the needle. The drug is slowly drawn into the 1 cc tuberculin syringe attached to the filter needle. A 30 gauge needle is then attached to the syringe. To remove the air bubbles, the syringe is tapped so that the air bubbles move to the top. The plunger of the syringe is pushed up till the drug appears at the tip of the needle. The patient preparation in the OR starts by instilling topical anesthetic followed by 5% povidone iodine drops. 10% povidone iodine is applied to the skin over the lids and forehead. A sterile towel is kept over the eye. A sterile plastic drape is applied, taking care to clear the lashes away from the globe. A speculum is then placed to keep the eye open. There are two types of eyelid speculum, closed blade and open blade. A closed blade type helps to keep the eyelashes away from the globe, especially when a sterile plastic drape is not used. After placing the speculum, the drops are repeated. The patient is then asked to look away from the site of the injection. Then a caliper is used to measure the point of entry, which is 4 mm or 3.5 mm from the limbus, depending on whether the patient is phakic or pseudophakic. Then the conjunctiva is moved to one side and the needle is introduced into the globe. The needle is directed towards the center of the globe. By displacing the conjunctiva, we make sure that the conjunctival and scleral openings are not in the same line. The drug is then slowly injected into the globe. The needle is gently withdrawn and the scleral opening is massaged with a sterile cotton swab. Light perception and finger counting is assessed after the injection to rule out central retinal artery occlusion. The eye is patched at the end of the procedure.
thank you. So that is the end of the presentation.
Thank